Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, this programme has discovered that the number of children in England with mental illnesses going to accident and emergency departments in hospital more than doubled in 5 years, largely because of a lack of suitable mental health services in the community. Our health and social care correspondent, Victoria MacDonald, has spoken to 2 families having to cope when their severely ill children could only get treatment many miles away from home.
That moment on the plane when it revs up and it's going into the sky and I'm thinking, what am I doing? I'm looking at Edinburgh, Scotland behind me and I'm thinking, I'm leaving my daughter there, you know, my desperately ill daughter.
I don't think there's a single Scottish patient here, and so a lot of us have, you know, had to come a long way to get here and get treatment.
These photographs are not the beginning of a happy family holiday, but the 280-mile journey from Nottingham to the only specialist mental health bed this mother could find for her anorexic 17-year-old daughter. She asked not to be identified.
Initially, there's just this massive relief. You've actually got a specialist bed, and this is a specialist bed, this is what she needed, and it wasn't straightforward getting that. We've got this bed, there's the relief, and then, you know, the reality, okay, 287 miles, how is that going to work?
Recent figures show that more than 2/3 of children with severe mental health problems in England are being sent for treatment miles away to cities like Edinburgh. But it's not just about beds. This family's 5-year journey through the system shows problems begin, they say, in the community, with the Children and Adolescent Mental Health Services, or CAMS teams.
2 years into our time with CAMS, a lady came on board and she said, why is your daughter not in hospital? She's clearly anorexic. And within a couple of weeks of her being on board, we had an appointment with a paediatrician. He said she's shown physical signs of starvation, she needs to be in hospital. So we had a 2-month wait. A 2-month wait before she got the specialist help she needed, and then that was in Birmingham.
She spent 10 months there before being discharged.
She came out of hospital on a fantastic diet, eating a range of foods, no dietetic input for the next year. And inevitably, she went downhill again, but back to square one really. And again, a wait for a bed. No beds, 4 weeks in a paediatric ward.
And this is a cycle that has repeated itself. Discharge, not enough support in the community, weight falling, mental health deteriorating, readmission. The daughter says once she was told she wasn't underweight enough to be admitted. In desperation, she completely stopped eating.
It shouldn't be made out that you do have to go to this extent to need help, because that's what I felt like, that I had to stop eating, I had to get to a certain weight to need help, because that was the message I was getting.
She has now been in the Edinburgh clinic for more than 5 months.
If I'd had the support I've got now from the start, I might have, you know, it might have not taken this long for me to make big amounts of progress. I might have not have ended up having 4 hospital admissions.
I feel 5 years ago, if I'd stood up and I'd shouted and I'd gone to the media and I'd got people to listen to, we wouldn't be in this situation now.
But the fact is, she did get treatment.
You don't go into an inpatient unit to get cured. You don't get cured of this. Unfortunately, they get to such a point where they're so ill they have to go to be refed to get back on track. But all the psychological work should happen in the community as part of your family unit. And if more money and investment went into outpatient services, we wouldn't need the beds.
Nottinghamshire Healthcare said staff and its CAMS teams always strive to address the needs of each patient and their families. They said services have changed enormously in the last 5 years with a real emphasis on CAMS, and that they are investing £21 million in services and increasing mental health and specialist eating disorder beds. Nobody thinks that it's ideal sending these vulnerable children hundreds of miles away from their home. And NHS England has recently said that they will fund up to 180 more beds. At the same time, the government has put more money than ever before into children's mental health services. The problem is that money isn't ring-fenced, so it's being diverted to other parts of the cash-strapped NHS. And now Freedom of Information figures from 97 hospitals obtained by Channel 4 News show the devastating impact this is having. Unable to get help, families are turning to the emergency services. In the space of just 5 years, the number of under-19s attending A&E in England with mental health problems has risen from 21,000 to over 42,000, a 100.2% increase. And hospital admissions after attending A&E, they've risen from more than 8,000 to almost 16,000, an increase of more than 99%. In fact, 17 of the hospitals who responded had seen a 200% increase in admissions.
I think the reason we're seeing more children turning up into A&E is because there's more awareness, there's less stigma, so people are seeking support. But actually, when they go to find that support, GPs don't know where to refer them, the community services aren't there, their needs isn't seen as great enough to get support, and unfortunately that means they turn up at A&E.
This family's journey is from Northampton to Maidenhead, by car sometimes 2 or 3 times a week. Again, a mother having to seek help far away from home for her anorexic 16-year-old daughter.
This week alone, due to meetings and clinical meetings, I'll have done 780 miles. And on average, it's 70 miles each way, so it's 150 miles in a weekend.
She is in the clinic now, but there have been times when they have actually been told, go to A&E.
Her weight was falling dangerously low. For 2 weeks we waited for a bed, but we couldn't get her into a bed because there were so many other CAMHS patients on the paediatric ward that there was no room for her. So when I went back to the crisis team and just said, you know, what do I do? And they said, well, if you're really concerned, take her to A&E. She was admitted that night onto the paediatric ward.
They both believe the local Children and Adolescent Mental Health Service, or CAMHS team, simply could not cope with her eating disorder.
They failed to provide effective treatment for my child's illness. And when they realised that they couldn't provide that treatment, they didn't escalate it. They didn't come clean and say, we can't provide what your daughter needs, she needs extra specialist help. It was all pushed back that it was her not engaging in the treatment and that basically, you know, you take what's there or you walk away.
And this is her daughter's perspective on what happened.
I felt that they didn't understand my predicament, and I told them endlessly, I don't want to recover, I don't want to get better, I'm so scared. And they basically threw everything in the books at me, everything they'd been taught, all the different models and strategies, and none of them were sticking because of my mindset.
Northamptonshire Healthcare wasn't able to comment on individual cases, but said, we take all concerns raised about our services very seriously and are taking steps to review the situation and act on any concerns or upset caused. There are times when the patient needs more specialist help and has to be sent across the UK to receive the best care. This battle with the mental health services and the fight to keep her daughter safe has of course left this mother at times completely emotionally shattered.
I think the lowest point was when she was admitted to the General Hospital this time. Her weight had dropped to 38 kilos. She dropped 8 kilos in a fortnight. She'd just given up the will to live. When the CAMHS nurse came to offer support to try and get her into the hospital, she'd locked herself in her bedroom, which she'd never done before. And she just said, you know, Mum, if you really love me, you'll let me die. And I just want to die. She said, I don't want to be here. Sorry. And I think it's really hard. And I remember the first time she was admitted to hospital, the dietitian had given her a sandwich. It sounds ridiculous, it was half a sandwich. And she sat and she looked at me and she said, Mum, if you really, really loved me, you'd let me die rather than make me eat.
Both the families acknowledge that eating disorders are complex. Yet in both cases, when they sought help, they believe they were let down, that the help wasn't there where it should have been.
Well, joining us now from Norwich is Liberal Democrat Norman Lamb, former health minister under the coalition government. In Liverpool is Labour's Luciana Berger, president of the party's campaign for mental health, and from Shoreham, Sussex, Conservative Tim Lawton, Children and Families Minister from 2010 to 2012. Now, I'm going to ask all three of you, please don't give me a big general answer to this first one, because I want to zero in on a very specific piece of policy that Victoria MacDonald raised in her report and ask you, a simple question, which is she made it clear that one of the big problems is that money is not being ring-fenced for children's mental health services. Will it be if people vote on this issue? Tim Lawton first.
She's right. I don't know whether it will be. I think it should be. And the government is putting record amounts, almost 12 billion, into mental health services. It is not ending up at the sharp end, which is why you are getting too many cases, desperate cases, as we've seen in your programme, with which I entirely recognise and empathise with those people.
Okay.
And it's got to get a lot better.
Thank you. Right, so we don't know on the Conservatives. On the Liberal Democrats, should it be, would it be ring-fenced if you were in power?
Yes, it should be, and it would be if we were in government. And my great frustration, and what you've exposed in your film, is an absolute scandal. And in the coalition, the last budget of the coalition, we secured £1.25 billion extra for children's mental health over a 5-year period. In other words, 250 million extra a year. And in the first year, which was 15-16, instead of 250 million, it was 143 million. And then in the next financial year, across the country, half of all clinical commissioning groups spent less than the amount that was allocated on children's mental health. And as your report said, the money is being used to prop up other parts of the NHS. This is an absolute scandal, and we are letting families down across the country, and it has to change, and the money has to be ring-fenced.
All right, so that's a yes from the Liberal Democrats. Luciana Berger, would it be ring-fenced under Labour?
Well, I have every sympathy with everything that we've just heard in that report. It was absolutely shocking, and cases like that just shouldn't be happening in 2017. And Channel 4 has been covering this for too many years of too many cases like this. Our Shadow Secretary of State for Health, Jonathan Ashworth, talked extensively about mental health earlier this week and set out all of Labour's commitments very, very specifically, and particularly was the point that we would be ring-fencing that money to ensure that it gets to where it is intended, because we are letting too many young people down right across our country. And we know that mental health problems first present themselves in young people. It just doesn't make sense that we're not really dealing with this problem when young people are presenting with them.
Tim Lawton, I mean, when you look at those figures, a doubling in the number of children ending up in A&E, is that something you are ashamed of?
I'm not proud of that at all, and it's a completely false economy financially, but more important, socially, because we should be doing more about treatment and about prevention. And I think, as Luciana alluded to, over half of mental health problems start when children and young people are under the age of 14. An awful lot of mental health problems can start around the time of pregnancy and in those crucial early years. And we need to do a lot more about perinatal mental health. Not doing that means that too many of these young people end up in accident and emergency, not the best place for them, more expensive for them. We should be doing a lot more at an early stage, which is why some of the policies that Theresa May did lay out the other day, and I'm really pleased that she's made it a high-profile issue in this election, is we want more mental health awareness, more mental health first aiders, and better in schools, and better signposting and availability of those services and support at an early stage.
To suggest that you were going to bring in 10,000 new mental health staff after you had got rid of 6,700 staff in the previous 5 years. And they weren't even staffed, this 10,000. It turns out half of them are volunteers and school teachers and all sorts of things. I mean, that's the kind of policy announcement, surely, that really brings politics into disrepute.
Absolutely.
No, we have not got rid of those people. We are desperately short in certain areas of the health service, particularly in mental health, of people coming forward to be community psychiatric nurses, psychiatrists and others. We need to do much better to recruit those people. We need to be doing much better around perinatal mental health, making sure that our doctors, our GPs are aware of the signs of mental health at an early stage. Look, this is not a good record of successive governments.
All right.
Because
well,
mental health has been the Cinderella service for too long.
It's not just successive governments, it's what's happened since 2010.
Well, let me just bring Norman Lamb, because you said absolutely in response to my question. I mean, you were in government during this period. You have to surely take some of the responsibility.
Well, look, when I was Minister, I recognised that children's mental health services were failing badly, that they were dysfunctional. I established a working group to look at it. We came up with a report which is called Future in Mind, together with the extra money, the extra investment that I talked about. And now, in this election campaign, the Lib Dems are the only party with a clear plan for the recovery of the NHS. We are saying that we need to increase tax, a penny on income tax. That's less than the cost of 2 coffees a week for someone on average earnings, but it would bring in £6 billion extra per year, which means that we can ring-fence £1 billion extra for mental health. It's all very well the government talking good stuff about mental health, but ultimately, it's absolutely cynical, because the gap between the rhetoric and the reality, without saying where the money's going to come from, just leaves people feeling even more disgusted by the political process. We've got to be honest about the need for extra money.
Luciana Berger, I mean, do you think... I mean, we've seen your policy today in the manifesto. I mean, the question inevitably is, does it have credibility in terms of where the money's coming from?
Well, it certainly does have credibility, and it's £6 billion more for the NHS. But what Labour has said consistently since 2010, it's not just the cuts that happened directly and specifically to NHS services within mental health, as you mentioned when Norman was the minister responsible for that area, but it's all those other cuts that we've seen within our communities that we know make a difference to actually keeping people well, or actually results in them becoming sick. And whether that's our cuts to children's centres, which support new mums and dads, whether it's the cuts to youth services, we know particularly for young people that they are most likely to speak to an adult that works in youth services. We know right across the country those youth services doors are closed. We know that drop-in centres for people on the verge of a crisis no longer exist. And it's all those prevention things that actually could make a difference and are so much cheaper. I mean, even if the Tories aren't motivated by the moral and social reasons why it's important to keep people well, it costs our economy, the social and the economic costs, a staggering £105 billion every single year. And it just doesn't make sense that we're also seeing cuts within our schools, which are actually at the forefront of supporting our young people. There are many schools across our country that are absolutely dedicated to supporting the mental health of their students, but cuts to their budgets mean that they are having to pare back on the support through counsellors, through workers that support them, mentors in schools, all that kind of extra
just briefly answer that
we know makes a difference. School nurses as well.
It's worth making the point, incidentally, that at the same time as the Prime Minister was talking about extra help in schools, the Health and Education Select Committees were pointing out that counselling in schools was being cut back. Yep. So this rhetoric is utterly meaningless.
Tim Lawton, just answer these 2 points.
Well, I think there's a lot of cross-party consensus on this issue, and it's a bit rich for Norman, I'm afraid, having been a mental health minister, a very good mental health minister, now to be criticising everything that magically apparently has gone wrong just in the last 2 years.
I'm just making the point that the money's not being spent
as it was intended. It's very easy, and I agree with that, and it's very easy, I'm afraid, for opposition parties to say 1 pence here on tax, 2 pence, 3 pence, whatever. I'm afraid in both the Liberals' case and Labour, they have spent that increase in tax so many times over.
Absolutely
and it's really
not.
disingenuous,
Absolutely
cynical,
not.
to say we can magically bring extra money in. We all know we have a problem with mental health. Let's work together, for goodness sake, to help kids at an early stage.
Luciana Berger, just find, I mean, don't you also need to take responsibility, Luciana Berger, for Labour's period in office, when this all started going awry, when, to be honest, the only Labour person who was talking about mental health in those years was Jeremy Corbyn?
Well, with all due respect to what Tim Lawton's just said, we've gone backwards since 2010, in terms of the cuts that you mentioned, in terms of staff, in terms of the beds, and all those other things that we know make a difference in our communities and our schools that no longer exist. It's no surprise that we're seeing more young people present in A&E.
Okay.
It was under a Labour government that we saw that record investment in our National Health Service. It was under a Labour government that we saw the introduction of campaigns that actually started talking about mental health.
Left out mental health in waiting time standards.
We must leave it there. Thank you all very much indeed for joining us, and thanks for dealing with the satellites.
I've been getting away with it all.